Hey everyone, Nathan Hayes here, IDOC Practice Finance Consultant, with the question of the week. And the question of the week is, what are the most important measures I should be measuring my practice in 2021? And I actually want to give one piece of advice at the first. You should have two sets of goals for this year, one for the first half that's probably more modest, just based on we don't know if there's going to be a second round of shutdowns. We're still kind of dealing with COVID and patients unwilling to come in. Many practices still have limitations on how many patients they can have in the building with social distancing requirements. So have a first half goal, and then we can set a second half goal as we have more visibility on what's coming. Now, in terms of what to actually be measuring, the normal rules apply here, but I would highlight two metrics that I think are very important, and I'll tell you why. The first would be the schedule fill rate. So this would be if we have 24 exam slots for a doctor in a day, or 20 or 16, whatever the number is, how many of those are we filling consistently? And I would certainly look for it to be above 90, 95%. With social distancing rules, with the backlogs of patients we have in many practices, it's just critically important that we make the most of that time when we get everyone in when we think they're going to get in. So whether that means going to Facebook if someone cancels or no-shows and say, hey, we have an opening, beefing up your recall process, all the way to the day before, texting, calling, whatever it takes to get people to show up when they say they will. It's very important. And this is an important thing always, but again, where we're limited and we have a huge opportunity to see more patients with backlogs, it's very important. The second thing I would look at is, what is my revenue per exam? And revenue per exam, as you're talking about this with your team, bear in mind that revenue per exam is an output for the standard of care being offered. So how much are we doing in terms of fees and taking photos, medical eye care, diagnosing and treating it, and managing it, selling products, so glasses, multiple pairs, plano suns, contact lenses, annual supplies, dry therapy scope, whatever is in your bucket, based on how much care you're offering a given patient, that's going to be expressed in revenue per exam. To be tracking that with your teams, one of the things that we've learned, I think, through COVID is when doctors and teams slow down and really do take the time to prescribe and make the case for why we should be your sole provider of eye care for your glasses, contacts, everything, patients respond and they buy. Now, some of that's that they didn't want to go get exposed at Costco, but some of it is that, if the doctor took the time to say it's important to do it here, I'll do it here. Revenue per exam is the output of that kind of behavior. So keep an eye on it, and mostly just because I don't know where it's going to go. There's a lot of reasons that capture rates increased in late spring, early fall into the winter, as we came out of shutdown, pent-up demand, desire for social distancing, extra cash from the stimulus. Maybe it changes, maybe it doesn't, but keep an eye on it because it's going to tell you a lot about what's happening, and you're going to be able to start thinking about how to respond. And finally, as you're looking at any metrics, and these two in particular with your teams, always ask two questions when you're looking at it. Use national benchmarks for sure, but you want to assess your practices changes over time and ask the questions, what's going right in this area? And then what can we be improving in this area? And even if you're doing well, there's always something you can do better or do more of, but invite your team to give feedback on, like, hey, what are some other ideas for keeping the schedule full? What are some other ideas for increasing our revenue per exams or capture rates, or what can we do better to get Optos photos? Whatever it is, ask your team how they can improve, invite them into thinking there. I'll leave it there. Again, this is Nathan Hayes, IDOC Practice Finance Consultant, and that was the question of the week.